Let's get into the nitty-gritty of what is HIE, Hypoxic Ischemic Encephalopathy. Hypoxic is another way to say lack of oxygen, ischemic, restricting blood flow, and encephalopathy affecting the brain. HIE can present as mild, moderate, or severe on the Sarnat scale at the time of birth or injury. Focusing on neonatal HIE, it's under the umbrella of what's called neonatal encephalopathy. And HIE is the most common cause of neonatal encephalopathy, about 30 to 40%. But other causes include perinatal infection, metabolic disorders, genetic causes, neonatal stroke, IVH, congenital brain malformations. And HIE can also co-occur with other causes of neonatal encephalopathy, like stroke and infection. Also worth noting that HIE can mimic other conditions listed under neonatal encephalopathy, and that's why sometimes it can be difficult to give an accurate diagnosis of HIE right away until imaging and further testing, like genetic testing, might be done. So let's get into what causes HIE. There's so many different causes, and then there can be multiple factors, especially in the absence of what is considered a sentinel event, and we'll get into what that definition is in just a minute. There's also pediatric-acquired HIE, which is out of the neonatal period, and there's also multiple causes of that. So when looking at the research, which we always do, and you can see the citations at the bottom, what can lead to neonatal HIE? So in utero, it makes up about 60%, sentinel events makes up about 35%, and sudden unexpected postnatal collapse makes up about 5%. Sentinel events are sudden events, often called to be acute, as opposed to chronic, or something that happens that is a designated event during labor or delivery. You can see there's maternal, fetal, and fetal-maternal. So cardiac arrest, asphyxiation of the mom, severe anaphylaxis, infections like COVID that impact the placenta, and maternal oxygenation that can lead to a sentinel event, but it can also be chronic. Seizures of the mom, hypovolemic shock due to excessive bleeding, fetal placental abruption, cord prolapse, uterine rupture, shoulder dystocia, meconium aspiration syndrome, fetal-maternal hemorrhage, gestational diabetes, preeclampsia, and HDFN. So there's a lot of things that can happen during gestation, mostly impacting the placenta, but it can also be caused by anatomical issues that can lead to HIE. So placental health can be compromised by maternal health, infections, genetic disposition and influence, maternal stress, blood pressure, gestational diabetes, and be difficult to detect until issues with growth, blood flow, etc. are known. And also anatomical issues with the mom can be a potential cause, and a lot of times you won't know until this happens to you. So in rare cases, cord issues can cause HIE in utero, which cords may become entangled and compressed, combined with factors of maternal anatomy, such as uterus shape, impact, either intermittently causing hypoxia or chronic, that can lead to decreased fetal movement with the baby being in distress. One that doesn't get a lot of attention because it's a lesser known cause or talked about cause is sudden unexpected postnatal collapse, SUPC. Babies born with SUPC typically have good APGAR scores at birth. They may have some issues transitioning from in the womb to out, but within expected parameters and limits, and may not require resuscitation, or might have required quick resuscitation and had good APGAR scores afterwards. SUPC typically presents as delayed onset of HIE symptoms, usually around 12 to 24 hours after birth, such as inability to feed well, neonatal seizures, they're often the first symptom, sometime turning blue. Unfortunately, positional SUPC can also happen accidentally. We see this, unfortunately, if parents are holding and fall asleep, with baby slipping into a position where they become asphyxiated. And typically MRI and EEG confirms HIE and rules out other causes, but there's also many other factors that can go into seeing if HIE was a factor, or if, again, there's further testing to rule out metabolic, genetic, and other causes. So how do you treat HIE? So part of it is depending on the severity of the baby, addressing basic symptomatic, systemic issues and controlling for those. So impact to heart, kidney, lungs, respiration, all of that. The one approved evidence-based effective therapeutic intervention for neonatal HIE is therapeutic hypothermia, but also it is resource dependent, and it is also one that only helps some babies. It does not help all babies with HIE. There are specific criteria that babies must meet in order to qualify for cooling. There's also many new therapeutics for neonatal HIE in various stages of research. We share about that all the time, and you can go to our website, hopeforhie.org/clinicaltrials to learn more. And then there's a huge focus on recovery and rehabilitation, or habilitation. And if you're not familiar with the difference between those two, habilitation is learning it for the first time, which is, babies. Rehabilitation would be something that, in childhood or later on causes an interruption in development and then relearning a skill. Also to note that there unfortunately is a lot of predatory misinformation and non-evidence-based treatments that have no safety or efficacy data whatsoever that target desperate communities like ours, and just to be aware of what those might be. This question comes up a lot about how you determine the severity of HIE. There's many pieces that go into determining an HIE diagnosis and severity level. At birth, you'll hear SARNAT scores used. Those are truly not to be meant as like a prognostic scale. They're supposed to be used at looking at the health and well-being of the baby at the time. So at birth, that takes account for APGAR scores, cord blood gases, and again, that SARNAT score, which includes an exam of muscle tone, seizures, reflexes, etc. And then we have diagnostic testing, which looks at EEG, so the function of the brain waves, what's going on in there from the electric, how it's working standpoint. MRI is looking at the structure of the brain, so the actual physical structure versus the how. And then looking at the clinical exam of what the baby is doing or systems affected. And so a lot of times it can be very difficult for families when they hear severity levels used by physicians or read them on notes or see them in online communities and read on the internet. Severity can mean different things at different times. And, hopefully this helps give a little bit more overview that this is truly a puzzle that comes together, and with more information, you get a better idea of, how a baby was, how they are, and then looking at, a prognosis, which sometimes is very, very difficult to give. Hey, we know this is really complex, and we want to make sure that you are supported through your HIE journey. We have comprehensive educational and support resources that are available through our organization. You can head to hie.support and you can access those. Connect in with our social worker, our child life specialist, our peer support network. We connect and support over 10,000 families worldwide and promote awareness, advocacy, education, research, and support.